All right, Dr. Nate, first off, thanks for doing this for us. We certainly do appreciate it. I guess with today, I mean, how are you? How are you doing? How you been through this whole thing?
Well, I'm doing well. The governor mentioned virus fatigue. I guess all of us are a little tired, ready to get over this pandemic, but this is a serious issue. I mean, lives are being lost every day, and this is really why we went into public health, those of us who are in public health, is to be here to protect and improve the health and well-being of all Arkansans. So I don't get tired of that.
And I guess too, what have the days been like for you, especially once we got really into the pandemic? And you know, you're kind of a household name now, which I think if you'd asked anybody before March started, who's the Secretary of Health for Arkansas, nobody would have had any idea, but now you're kind of that guy here in the state.
Well, that's the nature of public health. Most of what we do is invisible. As long as there's not an outbreak, people don't know about us, but that's what we do all the time, is we protect and improve the health and well-being of all Arkansans. With this pandemic, of course, our role has been much more visible. And I really appreciate the fact that the public has appreciated what we do and what my team does. And the unsung heroes, now all of a sudden we can see what they're doing. So I guess if I had more time out and about, I'd enjoy the notoriety more, but I'll just take everyone's word that people are watching.
I guess what's the day-to-day like for you right now, especially as we're getting into this? We've kind of seen some ebbs and flows with this thing. But for you, just day-to-day, whether it be professional, even personally, you know, kind of what's just sort of a normal day in the life of Dr. Nate Smith?
Well, my day starts with checking sort of the emails that have come in overnight, and I usually schedule some of the meetings that I need to do well before. Once we get up into mid-morning, though, you know, we're looking at the data, discussing with the governor what are the things that we need to address and highlight, and that sort of rolls on in until the afternoon press briefing. After that, then it's a chance to sort of process, look at some of these things, have some additional meetings, and if there's time, address some of the other things that, other health issues that are addressing Arkansans. But really our focus is on COVID-19, making sure that we're responding appropriately and looking at the data, taking action.
Now, just as part of your job, you kind of just eat and breathe this stuff, but is there ever a chance that you get to just sort of check out from it at all?
Well, first of all, keeping up with the governor is not easy. He never lets down. You know, he's like an Energizer bunny. So certainly, you know, we've got to learn how to sort of refresh on the fly. You know, even weekends, you know, checking in on lab results, things of that sort. But there's a certain pattern to it. As a physician, I'm used to that. My wife's an obstetrician gynecologist, so she's never fully off. But you just sort of learn to deal with that.
Now, what's it been like just being basically in the governor's hip pocket for what are we looking at, 6 months now?
It's been an excellent partnership. The governor has made my job about as easy as it could be, and so no complaints there at all. That's really what it's taken to address this. And I've talked to my counterparts in other states, and you know, they're working just as hard, so I don't feel like I'm singled out in any way. But I wouldn't trade jobs with anyone in this country.
For you guys, you know, when you break down the data, I guess, is there something new you try to glean from it on a day-to-day? I mean, obviously there's always the new case numbers, there's the county numbers, et cetera, but you know, I know some of us here at the round table have thrown some things at you. Is there different ways that you guys try to actually digest the numbers to where we can actually make better sense of actually what's going on with this thing?
Absolutely, and that's part of what data analysis is all about. Looking at the data in different ways. One of the big dangers in a sustained outbreak like this is just to keep looking at things in the same way, not asking the right questions. Unfortunately, we have a great data team. Dr. Austin Porter is our lead for this, and Dr. Mike Sima and others. They're looking at the data constantly, giving me new ideas, working with colleagues outside of the health department. But then the governor and I are looking at this from different perspectives. We listen to your questions, and we try and incorporate those into to how we present the data is just as important as how we analyze it.
What kind of balance do you guys look into, and especially when we were in, I don't want to say full shutdown mode, but in shutdown mode, what was really discussed in there to kind of find that balance? Because obviously, if we could just lock it all down for a period, this thing will go away. But obviously, as Governor Hutchinson has said time and time again, realistically, you just can't do that. So where do you guys try to find that balance at?
Well, with the lockdown, that was, we never did completely shut down. And because we didn't, we actually were able to sustain some of our interventions longer than some other states. It's kind of like holding your breath. You can only do it for so long before something starts to leak out. So we've tried to take a look at that very carefully. Now, when we went into phase 1, it was really based on a 14 days of downward trend. Well, no one's really been seeing that except maybe New Hampshire lately. We're all experiencing increased number of cases, and how do we mitigate that? How do we, to some extent, live with the virus, but how do we keep it from causing any more disease and death than it absolutely has to?
Now, not to get too political here, but do you think we've handled it probably the way we should have? I mean, obviously, we're seeing this kind of wave, but Arkansas is not immune to that when it comes to this thing across the country. But, Dr. Fauci has kind of said some things like maybe we've kind of gone too open too fast. Is that safe to say, or has Arkansas maybe approached this the right way?
Well, I mean, there's two ways to take that question. One is, how have we as a nation dealt with this, or how have we as a state? We as a state, I think, have done about as well as we could with the resources that we have available to us, with some of the constraints that we've had in terms of supply chain. We've tried to take advantage from as many lessons learned from elsewhere, but this is a situation where everyone is experiencing it at the same time, and no one's ever done it before. Typically, you'd have at least someone who had done it before. You could learn from them. We're all having to some extent, make educated guesses and to do it together. And I think we've done it here in Arkansas about as well as we could. I would like if more Arkansans perceived not only that this is a serious problem, but this is a serious problem that they can really do something about, and that the efforts that they make will protect not only themselves, but their loved ones and their communities. And I think sometimes that message has been distorted from various sources.
How do you think we got to a point where, some of those precautions have gotten so divisive and really kind of political?
Well, part of it is in our nature. We just don't want anyone telling us what to do. I mean, that's part of the American spirit, and that's part of how we are in the South. We just don't want someone telling us what to do. And we celebrate our independence. We reward and appreciate independent thought. But there are some times when we really do need to take collective action in order to preserve lives.
Let's go back to the beginning of this whole thing. When did you first get wind that COVID-19 was a thing? I had heard because I'm an infectious disease specialist and I'm naturally attracted to the latest infectious disease outbreak. I had read some preliminary reports, but I got a call from Dr. John Dreisner at the CDC. He's the director for the Center for Preparedness and Response, a friend of mine, previous state health officer in Tennessee. He called me up. He said, "Nate, I don't know if this is going to end up being anything, but there's this virus in Wuhan, China. It looks like it's spread mostly from animals to humans. We're not really seeing evidence for human-to-human spread, but I just want to let you know about it, gives you a heads up." Well, of course, later, this has become, the largest pandemic of our lifetimes. When it finally got to Arkansas, kind of what was your thought process? What was sort of the mentality on trying to, because Arkansas was one of the last states to actually report cases, and now here we are.
It was, and we were looking very hard. We had limited laboratory testing capability at that time, but we were using it anytime we had someone who looked like they might be a case. Of course, we were particularly looking for those with history of international travel, so it's a little bit ironic that our first case was someone who had come from Louisiana.
I guess looking back, was there anything that you might do different than what we have done?
Well, there's all sorts of things that I would do different. To live through any life experience and say you have no regrets, nothing that you'd do differently, that basically is saying you've learned absolutely nothing. No, we've learned a lot. And I would think that we would collectively have done things a lot different. You know, if we knew where things were going to end up. Certainly having earlier, larger testing capacity would have been a benefit. Certainly if it could have been contained within Wuhan, China, you know, before it spread. You know, these are all things that it certainly would have been worth a huge international investment to attack the problem then and there. But that's, you know, again, who knew at that point? But you know, we're still learning, and there are things that you know, that I might have done differently last week or the week before if I knew exactly where things were heading.
So I guess what do we actually know about this virus currently? Because it seems like even the knowledge of it has sort of evolved. You know, like you mentioned, it started from animals to humans. Well, now we know it's communicable human to human. Sometimes it surfaces. We thought summer would have killed the thing off. I mean, I guess, what do we actually know about this thing? We're
learning new things all the time, but there are still some very critical questions that are not fully understood. We do know that wherever it's the details of its origin, it is very well adapted to human transmission. Really, I can't think of another virus that spreads as readily and as rapidly as COVID-19. It's spread throughout the world in a matter of months. And we've seen what happens in these congregate settings, high rates of transmission. So that one we know. We know that, fortunately, we know what can limit its spread too. We know that wearing the face masks to accomplish source control you know, has a tremendous impact as long as everyone's wearing them. We know that the physical distancing, you know, those droplets don't go beyond 6 feet or not much beyond 6 feet. And you know, we know that that it doesn't appear at this point that we've got a chronic infection like HIV or something like that. So if we can keep it from spreading long enough, it will disappear. Now, some important questions that we don't have the answers to have to do with immunity. If you get it, do you remain immune for a significant length of time? Unfortunately, recent reports suggest that that may not be the case, that at least in many individuals, antibodies will disappear over weeks to months. And so at least it's possible that people could get reinfected.
Is that something different than what we've seen in other viruses? Because I know a lot of people sort of associate this as like the crazy cousin of the flu, or even something as like the common cold, where, you know, your body kind of builds up that immunity. You still get sick, but it's just not as rough.
Well, the other common human coronaviruses that cause cold-like syndromes, you know, we don't develop lifelong immunity to that. If we have much immunity, it's short-lived because, you know, you can get the same thing the next season. So again, this is a new virus. We can say it's like this or it's like that, but it is really unique. There's nothing exactly like it, but that's something we're still trying to learn. If that's the case, then that changes our strategy. And certainly when people have talked about herd immunity and things like that, if you don't have long-lasting immunity, then you can't get herd immunity.
How close are we to a vaccine, or at least something to where we can, you know, like the flu shot, for example, not necessarily you cure it, but like the flu shot, you sort of limit the time you have it and I guess the extent in which you have it?
Well, it's a very good question about vaccines, and a vaccine that was even only 50% effective would be a game changer. We could really change, we could really bend the curve with a tool like that. Obviously, we would hope to have a vaccine that was fully protective and gave long-lasting immunity, but even something quite short of that would be an indispensable tool. the pace of vaccine development for this virus has been faster than we've ever seen in the history of vaccine technology, and there are already vaccines that are going into trials. So depending on the results of those trials, we could have a vaccine candidate even before the end of the calendar year, and certainly reasonable to expect early in 2021, which is really amazing considering how long it normally takes to develop a vaccine.
Do you think people are taking this as seriously as they should? Because there's I guess a couple of schools of thought of this is just a glorified flu to you're going to die if you catch this, and usually the answer is kind of somewhere in the middle. And we've seen some of the mortality rates aren't as bad as what a lot of people perceive them to be. I mean, for you guys, obviously one death is too many. But is that maybe a problem or something that gets tossed around in sort of the political arena of this whole thing?
Well, of course, politics muddies the waters in general, but in terms of deaths, we've talked in our conferences about deaths being a lagging indicator. We won't see those deaths until weeks and weeks after the cases, because people who get sick enough to end up in the hospital, they can languish in the hospital on a ventilator for weeks before they finally succumb. And so looking at our deaths now compared to our cases now, that's apples to oranges comparison. Really, the deaths that we're seeing now represent the cases that we had a month or two ago. Now, having said that, psychologically, it's really difficult to adapt to change. We all know that in our own lives, and and in the community level, that's true as well. And this pandemic has required major change, and so we psychologically resist that. And so it's easier to go places that don't require really much of a change. And one of those is, well, this really isn't as serious as people say it is. I can go on with my life, just sort of the ostrich head in the sand type of approach. It's not really that bad. I'm just going to ignore it because maybe it will go away. And we have children. As children, we would do that. You can't see me because I can't see you. Right. On the flip side, there's the this is bad, but it's so bad that there's nothing we can do about it. I was in my neighborhood the other day, and one of my neighbors said, some people are saying that eventually we're all going to get it anyhow, so why resist? Well, that's sort of the opposite end, but it's the same thing. Since I can't do anything about it, I don't have to do anything about it. The truth is that it is serious, and that there are going to be people who die, and there are going to be people that we know, that we care about, who lose their lives because of this. But there are things we can do today to help prevent that and to make it less impactful, less harm. And so we should do those things. That's a hard thing psychologically to embrace, but that's what we need to do collectively, is say, yes, this is serious, and yes, we can do something to protect ourselves and our communities.
You've said in the briefings before that this virus affects children a little differently. What have we seen so far, and how does it affect them, and do we even know why it affects them differently?
Well, there's a lot of unanswered questions, and hopefully you'll get Dr. Jose Romero in this seat at some point, because he'll give you better answers, being a pediatric infectious disease specialist. But fortunately, and that is a blessed thing about this situation, if there's anything, is that children seem to be less impacted than adults. And that's certainly not true with a lot of infectious diseases. A lot of infectious diseases, they adversely affect children disproportionately. In this case, children are less likely to develop severe disease, but it still does happen. And it does seem that they're not, they don't seem to be at least more likely to spread the disease than adults, and that's also a blessing. But there are some real challenges. This multi-system inflammatory syndrome that can occur as an immune response to the virus, that can be very, very serious, and we see that more in children than we do in adults.
So I guess with all that in mind, the biggest thing we're getting is parents. School's coming up. Is school going to be a safe environment? I mean, you figure a lot of districts are going to take the proper precautions as best they can, but is that an environment where we're just looking at a petri dish, or with that knowing that it just affects children differently, that maybe they'll actually end up being okay?
That's a very good question, and I would have to say that's a question that no one fully knows the answer to. School is important. There's a reason why we do it, and we wouldn't want to give that up unless we had exhausted every opportunity to make that happen. We know that that there are some tremendous adverse effects by not having school, and we know that our children have in some ways suffered by having to basically end in school instruction early this last semester. So there's a compelling reason to want to give it a try. Whether we'll be successful or not is going to depend on a lot of things, including where we are, at least here in Arkansas, with the number of cases and how active we have transmission at that point.
I guess on that note, with kids being in school, have you just noticed or seen, how has this affected them from a psychological standpoint? Has it affected adults more so, especially with having to close school down, and it was very sudden having to do that, and everybody's kind of trying to figure things out on the fly? It seemed like the kids have adapted to all that stuff a lot better than maybe what the adults and even educators themselves have.
Well, that's true. Children do tend to be more resilient than adults are. I have a 14-year-old at home, and to her it's not a big deal. She's rolling with it. Yeah. I know it affects her, but yes, the adults I think probably struggle more than the kids. We, though, are amazingly resilient, and if you look at what people have gone through, whether it's tornadoes or floods, what communities have been able to do and bounce back, we know what we're capable of. It's just we've not really had something like this that has affected all of us at the same time, especially something that has as much uncertainty. Every decision we're making is open to being second-guessed because it's not like people have always been doing it this way. This is the first time.
I guess, too, in terms of this virus affecting populations a little more so, as we've seen that the minority community seems to be more adversely affected. Is that a biological thing? Because we know there's different diseases that kind of affect different groups. And is this one of the same ones, or are we seeing a lot of times it's more the socioeconomics of things that we're seeing a lot of the minorities being affected by?
We don't have much, if any, evidence that there's a biological phenomenon going on here, but we do know that there are cultural differences, there are socioeconomic differences, and then there's just, however you want to put it, providence or just, bad luck. In Arkansas, some of our first cases were in our African American community, and so we saw case numbers in our African American community really increase at the beginning. Now that sort of leveled off. More lately, we've seen huge increases in our Latino communities. And then our community from the Marshall Islands have been very, very adversely impacted. So this is moving around different areas, but there's no population that can say you're safe, because it's really the behaviors. If the virus has an opportunity to infect you, it will do so.
So I guess, why are we seeing that, especially here in the northwest part of the state? I mean, obviously we've attributed some of it to just sort of the work environments up there, and obviously in the poultry industry, it's a very heavy Latino population that works in that industry. But are there any other factors that we see? I mean, because this thing just blew up in that Latino community up there.
Absolutely, and I think part of it really is occupational. Some of those industries that were affected profoundly were ones in which workers were in close proximity to each other, whether it's in a poultry processing plant or riding around in a van together. There are industries just where people are working and are in close proximity, and that was a big part of it. We also have communities that are used to gathering together on a very regular basis and in large numbers, and that can also facilitate the spread. And then if you look at housing as well, when you have multiple individuals, sometimes several families living in close proximity, that can also facilitate the spread of COVID-19.
I guess the one thing that I think people, and even myself, don't understand is how communicable is this disease? I mean, obviously it can spread rapidly, but what does that really mean? Does it mean like if I'm in the grocery store and I just walk past somebody like, oh man, can I catch this? Or, you know, like you mentioned in some of those sort of factory assembly line type of settings, you know, they're all kind of hovering around each other for, you know, 8 hours, 10 hours a day. Is it more we're seeing in that environment, or could I just catch it, you know, if I cough in the same vicinity as, you know, as we're sitting right here?
The highest risk is when people are in close proximity to each other and basically breathing each other's air. If we weren't as far apart as we are right now, then we would be a high risk, especially if you keep asking me questions. But the longer you're together, the closer you are together, the more you're breathing each other's air. Those are the highest risk settings. People who live together in the same space, that's probably the highest risks. Passing someone briefly, much less of a risk. We usually consider someone to be a contact if they've been within 6 feet of each other for more than 15 minutes, especially if there's no face covering or face mask. Now, having said that, we do have what are called super spreader events, where for whatever reason, someone, due to the phase of infection or something about the anatomy or physiology of their upper airways, you know, they end up exposing a lot of people, and so you get a lot of people exposed all at one event. So if you have like a group of people, like there was an episode where, an event where there was a choir that was practicing together, and the singing tends to produce a lot of small droplets that travel much further than 6 feet. So lots and lots of people end up getting sick from that. So these super spreader events can happen, but they typically will happen in these large groups where people aren't wearing face masks. And so if those can be avoided, we can reduce the number of super spreader events.
I guess, what does Dr. Nate Smith, what do you stress about the most when it comes to all this stuff? Is it just the ever-increasing numbers, the hospitalizations now, the deaths, you know, the public not playing ball with some of the directives, having to answer the questions about the directives? What do you stress about probably the most when it comes to all this?
My biggest concern is that people will get tired of doing the things that they need to do to protect themselves, their loved ones, and their communities. And you know, as in a lot of life, you know, we really have to have the endurance to persevere. This virus may just wear many of us down. And although we know how to protect ourselves, we just give up and give in. And then that will cause unnecessary disease and death. So helping each other to learn how to change and adapt so that these things that we need to do to protect ourselves are things that we just incorporate into our normal daily lives. I know there's a lot of resistance to that. Change is hard, but if we can do that, we can protect one another. We can help get past this thing sooner. If we give up the effort, then we'll be dealing with this for a long, long time.
Let me get two more in here real quickly. Are you tired of us yet, the media guys?
No, I'm not tired of you guys at all, quite honestly, because we need you to get the message out there so that people don't forget and do foolish things that end up causing them harm. And so you are an essential part of the public health response.
When will this be over?
That's not the $1 million or $1 billion, trillion dollar question is, when will this be over? I was kind of hoping it'd be over by, by the middle of this month, but it doesn't look like it's going to work out that way. Dr. Romero will have plenty of work to do. It's hard to know. I think that we will either find a way to get rid of this virus, or we'll find a way to adapt to it, one way or the other. But no one really knows how long it's going to be at this point.
That is not the answer that we needed right now. No. Right on. We'll call it there.